Good morning. Welcome to AMCHP 2018. My name is Nisa Hussein. I'll be your moderator for today. I'm a program analyst for the Workforce and Leadership Development team at AMCHP. This presentation is entitled Building Skills for a More Strategic Title V Agency. This session is accredited for continuing education. CE information is available on the conference website, mobile app, and the registration desk. If you could please silence your cell phones to avoid disruptions, that would be great. Now it's my pleasure to introduce our presenters. We have Stephen Orton. He is an expert in helping organizations develop leaders and create change. Steve leads the Change Management Core for the Workforce Development Center. He facilitates strategic planning and teaches on leadership and management for local health organizations. He also co-leads the national program of Kresge Foundation's Emerging Leaders in Public Health program. Steve is the lead author of Business Planning in Public Health, A Practical Guide. He has a master's and a PhD from the University of North Carolina, Chapel Hill. Amy Melinek serves as a Senior Collaboration Manager for the National MCH Workforce Development Center. In this role, she coordinates the learning functions of the center, focusing on innovations that emerge from the interdisciplinary nature of the center's activities and ensuring Title V professionals are prepared to lead health transformation all across the states and jurisdictions. She serves as the primary point of entry for states and jurisdictions wishing to explore potential collaboration with the center, as well as a coach for cohort teams. Amy previously worked for local public health departments, a federally qualified health center, a hospital system, and a state MCH nonprofit agency. And we have Janine Herrick, an MPH, works as a workforce development associate at the North Carolina Institute for Public Health within the University of North Carolina, Chapel Hill's Gillings School of Global Public Health, and works closely with the National MCH Workforce Development Center. Ms. Herrick has an extensive background in maternal and child health and working with statewide collaborative initiatives. She has a wealth of experience in program design and implementation, strategic planning, and donor relations. At the NC Institute for Public Health, Ms. Herrick designs and conducts trainings on a variety of topics, including cultural competency, strategic decision-making, evaluation design and implementation, and effective training skills. Janine provides technical assistance to a variety of state and national partners conducting assessments, facilitating strategy sessions, and supporting public health leaders through transformative leadership development opportunities. So, ladies and gentlemen, please welcome our speakers. I'm going to pass out the stage.
Thanks, Nisa. Great to see you guys. Thrilled to be here, and welcome to our time travelers. We have time travelers who are here with us from the future. Hope you enjoy the show. Great to see all you guys in the flesh, though, because that's how I prefer to work. We're from the National Workforce Development Center. We've got all kinds of technology. Because of the time travelers, we have to use the special clicker. We're all here with you, and you're all here with us because we care about strategy. So let's spend 3 hours thinking about strategy and what that means and how we could maybe do it better. I wanted to get a quick sort of snapshot of who's in the room, so I thought we could play the holler out your state as we go around the room game. So I'll start, and I'm going to holler out my state, and then we'll just like rapid fire shoot around the room just to sort of get the gist. Ready? Okay, North Carolina.
Virginia.
Texas.
Kentucky. Maryland. Massachusetts. Iowa. Massachusetts. Oklahoma. Oklahoma.
Iowa.
North Carolina. South Carolina. South Carolina. Maryland. South Carolina. Hawaii.
All right.
Iowa. Washington State. Idaho. Kentucky. Florida. Missouri. Minnesota. Love it. North Carolina. Colorado. Alabama.
Alaska.
Louisiana.
Who did I miss?
North Carolina.
That's some more. Florida. All right. I think Alaska's got to win for. Oh, well, Hawaii. I forgot about Hawaii because we got Hawaii and that's sorry, I forgot about Hawaii. Came way further. Alaska's a tough trip. Puerto Rico's probably a tough trip too. Not so bad. All right. Welcome all of you all. Have you heard about the center? You know about the center? We're about systems integration, change management, adaptive leadership, and we have a group now called evidence-based decision making, which includes lots of different parts. All of this we feel is quite strategic, and our services, we're anxious to work with all of you that we haven't worked with yet, and to continue working with so far, like Louisiana and Florida right now. We have single state work going on in both of those states. And I think some of you are coming to our cohort that we just started, including New Mexico and Iowa and maybe a couple of others. Let me start by saying we do a ton of change in this field. You all do a ton of change in this field. Holler out some ideas to your table of big things that we've changed, fixed, transformed in the last, I don't know, 10, 20 years. Just at your table for 1 minute. What are we crushing? What big demons are we fighting? All right, just give me a flavor, one thing, one big thing that we maybe fixed or are still fighting with. Teen pregnancy. We made a kind of a dent in, which is kind of amazing. There was probably a strategy that helped move forward on that. There was probably a strategy. How about here?
Almost every baby in America now is screened for hearing loss.
Woo! How in the heck? What an amazing amount of work. What an amazing amount of work to do that. How about here? Infant mortality. We haven't quite whipped that one. And yet, a whole lot of work getting done. A whole lot of work getting done. How about here? Preventing preterm births. Still working. So we've got a range here of one that sort of feels like, yeah, we made a big milestone. And then some other stuff that's just huge, we're probably never going to totally fix. But we can make strategic decisions and get better results, change the results that we're getting by changing the system and thinking really hard about it and getting the right people on board. So that's really what we're about doing for the next 3 hours. We've organized this around strategic questions, uncovering perspectives, using strategic decision-making skills sort of on the individual level. So we're working individual, team, agency, organization, community. We're thinking sort of that way. So there's some individual stuff that we can do for ourselves, and there's some stuff that we can do for people who work for us or people who work near us in agencies to help them be in the space to think more strategically. And then we can learn some things, try some new things to make sure that the communication is getting out, that people are understanding what we're thinking, doing what we want them to do. So those are the 6 big parts. We're going to talk a little bit about all of this. We are going to work on, we're about tools at the center. Y'all are so good. We feel like you're just really good designers, builders, and that if we can give you some new tools so that you can build a little faster, a little better, a little more accurately, you can cut cleaner, that you'll know what to do. So we're going to try to bring you tools, and you will know what to do back in your workshop with those tools. There's a short list of the tools you're going to see today. Okay, the best thing that happens at a conference like this is you talk to other people who care about the same thing you care about, and that's the people in this room and at your table right now. So let's talk just real fast at your table about when you think strategic, what does that mean for you? What does that look like where you sit? So that's sort of where am I now with the word strategy, and what do you want to learn? What would be a great home run for you? What do you want to learn or leave with today? Okay, let me give you 4 minutes. You have to go fast around your table. So a quick summary of what I've heard, or what I heard from my auxiliary ears. How do we stick to a plan? How do we find and align activities? partners, all the partners to know and agree and sign on and engage. That's pretty high level. You have your own personal idea of what you want to learn, and I'm hoping that many of you, and at least a couple people at each of the tables, have a strategic challenge or a strategic question in your head right now that you're trying to make some headway on. We're going to ask you to share that throughout the course of the 3 hours and get some help. If you're not at that point yet, if you don't know what your one strategic question is, that's okay. You can help somebody else think about theirs. That would actually be a huge benefit to them, and it's going to be a huge benefit to you because it's going to help you frame yours next. Okay, there's a great article that came out last year, I think, from the National Consortium for Public Health Workforce Development. It's all about strategy, and they introduced this T. Essentially, they're saying in public health, we've been really good in our silos and our specialized skills and our disciplines. We need to get better going across, instead of up and down, going across. So their sort of recommendations are these 5. Elevate strategic skills so that they're equal with specialized skills, so that in our agencies, we're like pointing people out and reinforcing people who are thinking strategically and doing strategic work. Invest in skills development so that happens more. Build systems that help that happen. Develop training, and I hope that we're being engaging and strategic right now, and creating coordinating mechanisms. And I think MCH gets called out in this article as a field for thinking and doing a lot of these things already for a variety of reasons. I think you can probably point to stuff that's happened on all 5 of those in your field in particular that's worthy of modeling. We are funded by HRSA to do effective engaging training. We've gotten a lot of money and a lot of support from them to do that for you. That's one example. Coordinating mechanisms, how about Block Grant 3.0? I mean, the work and the attention that's gone into this in your field is really impressive. So, going across the top of the T, these are the 8 things that they list in the article. I should mention Mike Frazier is one of the authors of this article. He used to be the CEO of AMCHP. And he wrote it with Brian Castrucci at the Beaumont Center, who also came up through MCH. So they're thinking MCH. This is why this sounds familiar. So there's their list of strategic skills. And I think we're going to hit a lot of these today. We think in our center that we're spending a lot of time on systems thinking, change management, data. We're in our design, we're trying to help people problem solve. We have a group now that does diversity and equity. I think that's really important. I was at the MLK yesterday, and a lot of the quotes on the wall at the new MLK, Martin Luther King monument down by Jefferson Monument, are about systems thinking. They're about systems thinking. They're about everybody's connected to everybody else. We need to think not individually, but system-wise. Okay. Strategy. We're going to start with strategic questions. It's really important to be asking the right question, or the answer that you get won't do what you want it to do. So we're going to talk a little about that. You're going to talk about that. And then I'm going to do a little quiz for you on distinguishing adaptive challenges from technical challenges. Adaptive challenges are the ones like the ones you guys just mentioned, on which we can make progress, but we're not going to solve them. There's not an expert who's going to come and solve infant mortality for us. That expert does not exist. And I want to emphasize that what we're doing today, where you're going to start using system tools, is what you do to build system thinkers. So back at home, if you want more system thinkers, use more system tools. Start using system tools, and you will develop systems thinking. We're going to also give you some examples from our work with you all throughout, and so we're looking forward to sharing some of those. So first tool to use, strategic question checklist. This is in your stack of handouts. If you have a strategic area in mind that you want to focus on, now's the time to bring that to the front of your brain. When we do strategic work with folks, we start with strategic questions. This is one of the tools to figure out whether or not the question that you have framed for yourself is in fact strategic. When I do this with folks, the very first time I meet them, I say, so what do you think the strategic questions are? And they usually get pretty close. They usually get pretty close to the questions that they want. But they're mixed in with a bunch of questions that aren't strategic. So you have to knock those out. So this is how it works. First, you frame your strategic question. And we usually start with these first three. So frame a question in your head. And basically, this is like, what's the one big thing we need to do in the next 3 years? A big thing we need to do in the next 3 years. And we start with, it's only a question if it can have multiple answers, right? So make sure the way you're framing the question in your head has a question mark at the end of it. That shows it's a question, and it's got multiple answers. There's more than one way to answer that. If it feels big, that's good. It needs to feel big. It needs to feel like we're not going to solve this next week or even in the next 6 months. It's really big. And there's a little bit of excitement, maybe a lot of excitement when you think of that question. Little hairs stand up on your neck. The tool really focuses down, and some of the work that we're going to do with you subsequently today focuses down on number 4. Does it resonate with reality? Does it resonate with the assessment work that you're doing? And 5, and this one's a good one for some people, what if we didn't answer this question? What would be the consequences? If the consequences of not answering the question are dire, then you have a strategic question. If the consequences of not answering it are, well, that'd be okay, we would just pick it up again in 3 years, it's not strategic yet. So we're trying to measure authenticity, the level of the question. We're trying to confirm that it's engaging. We're trying to confirm that it's responsive to your environment and aligned with the work you're doing now, and that it's essential. That's what you want. This is just what we did in Kentucky last year with the Commission for Youth with Special Health Care Needs, and Ivy is actually in the room. She's in that picture, and she's in this room where I'm not sure where she went. There she is. So you are wearing the same jacket. Thank you for doing that.
It's her strategic jacket. It's strategic. It's the strategic jacket.
It's the strategic jacket. Strategic tip, wear the strategic jacket. We got on the phone with Ivy and some other leaders in the department, then we came and did a day and maybe a day and a little more with a great big group, including stakeholders. On the phone, we came up with some pretty good strategic questions. Working it with the group over the first couple of hours, we came up with 3 really good strategic questions that you'll notice are linked. How can we enhance our brand? How should we be delivering services? How will we expand our reach? Whew, I got a chill just saying those out loud. Do you still get a chill from those, Ivy? They're big. They're big. Do you want to tell the story about changing your name? One of the things that came out of this, I don't know if this is the right time to tell this, but somebody at this session, one of the groups said, we might think about changing our name. I'm not sure our name is really doing what we want it to do. And then what happened?
And then we went through this process. Of course, that was one of the things on the list. But we're currently in a legislative session, so we had to move very quickly. But we did survey our staff and talk to communications departments. And basically, we're in the process of changing our name. So this meeting was in August, and it is now in the Kentucky legislature to change our name.
There was a call from the governor.
Yes, there was a call from the governor, Commission for Children with Special Health Care Needs, and the governor wanted it changed to the office because we no longer are under a board of commissioners. So we took the opportunity to say, okay, if we're going to change office, can we change more than that? So
These are the key words. We took the opportunity. We took the opportunity. That only happens when you see the opportunity. They saw the opportunity, at least part, because it was on one of these sheets that came out of the strategic planning meeting. That's see it. It would not have looked at all like an opportunity 6 months before, probably. It would have looked like, oh, geez, now we're going to do that also on top of everything else. But no, and now it's, we took the opportunity. That's so beautiful. I'm going to turn you to your table. Find a couple people at your table who are ready and willing to, who have a strategic question. Maybe I'll give you just 1 minute to decide. Who are are there some people at your table who are ready to go and want some help working this sheet? Does every table have a willing guinea pig? All right, well, it looks like we have willing guinea pigs. Let me give you like 3 minutes. Can I give them 3 minutes? 3 minutes to just work through this and see how it works. All right, you guys ready? Let's roll on. We're gonna spend substantial time digging around in the ground that you just broke. We're gonna spend substantial time digging around in what you just started. So fear not, we will be back to this same place with some fresh tools to dig even deeper. So some people are talking about national NPMs, talking about an NPM is a measure, right? It's a measure. One of the strategic question worksheet would be the worksheet where you say, what are the strategies? What are some strategies that might work? This is actually what's happening in the picture. There's Ivy and there's Amy Mullinex. On that flip chart at the top, it says, how can we enhance the brand? How can we enhance the external brand? So they're working on question number 1. At the top of the sheet is that question. How can we enhance the external brand? There are many different answers to that question. That's how they know that one's strategic. Everything we had done so far in terms of stakeholder awareness, mission, vision, values, mandates, external forces, opportunities and threats, strengths and weaknesses. So they're trying to come up with strategies, and then having come up with strategies, they're going to try to come up with new programs, training, policies, partners to work with, and they're going to come up with what would be measures of success. How would we know we had done something good around that? What's our measure of success we're going to look at? Questions on the worksheet? Seem pretty clear? The strategic question assessment. The one that you just worked on, the strategic question checklist. It's about making sure you're asking the right question first before you go too far on developing strategies. It's really important. This all comes from John Bryson, who's really good on governmental strategy and nonprofit strategy. Now, the strategies are competing answers to the question. You want to brainstorm as many strategies as you can. You want to brainstorm big. You want to brainstorm way across. You also want to brainstorm practical. Just get as much on there as you can and then apply a filter to figure out which of these strategies is actually the right strategy for us right now for this question. That's going to generate action steps. Action steps. And the action steps might not be very specific. If you have a big adaptive question, the action steps initially might just be about getting smarter. That's fine. The action steps might be looking for opportunities so that you can see them when the governor writes and said, you need to change your name. It needs to have office in it now. And it might mean trying some stuff that you don't know if it's going to work or not, but you're going to test it. All of these slides are up on the brilliant AMCHP website for the conference, so fear not. What do I mean by adaptive? What I mean by adaptive is there's not a technical fix. There's not somebody who's going to fly in and tell you how to do this. Believe me, you have an adaptive challenge. The definition of an adaptive challenge is that it's not clear exactly what the problem is. It's hard to define. It has multiple pieces. People see it differently. And nobody knows what the solution is. If that's the case, the only way to solve it is to put the work on the stakeholders. There's not an authority you can call to put the work. There's not a consultant you can hire to give the work to. That is the nature of an adaptive challenge, and that's where you guys work.
Sorry, so what I'm thinking about when you're saying that is also the question about evidence-based practice, right? So we're sitting here and we're thinking, what is my strategic question? And you've done all this work in your office and you've gotten the question really big. Then you're like, but I'm supposed to follow these evidence-based practices. So how do you balance those? And my response to that would be, go back one slide, the evidence should be used to learn from. The evidence isn't necessarily your strategy. The evidence is an input into your learning. Is that making sense? It's hard, I think, to put these pieces together, that the strategic question is the big thing, the evidence is what informs the learning, the stakeholders inform the learning. So
that was very useful. That help? Yeah, it's not that you go to the evidence for the answer, you go to the evidence for the learning. It's all about the learning. Awesome. So, really fast, one of these is a technical question. The answer that you would get if you asked it will be a technical answer that you could get from an expert. One of these questions is an adaptive question. The only way to frame, move forward, and even make a dent in the question would be to involve stakeholders. Which question has a technical answer? Which question has an adaptive stakeholder answer? Screening is the technical. I mean, that is a question, and there is an answer to it. If you want to know how to screen new moms for postpartum depression, you go on the web and you can have the answer in 10 seconds. And if you looked a little further, you could also go to the research and find out that screen won't work for doing the top thing. It just won't. By itself, the screen will not help you manage depression in new moms in your whatever area you're in. It won't do it. That's why it's so important to ask the right question. If you ask that bottom one, you will get an answer that won't move your measure that you care about. You will get an answer, and that reduces tension in the room with your stakeholders. Your stakeholders would like the tension in the room to go down. So some of them will try to make you switch it. They will try to sneak the technical question in there as a replacement from your harder question, because the hard question is hard. A lot of us like to check the box and know we got the answer. We're not working in that space right now. So now you'll be able to recognize that move. Someone will try to sneak in a different question that you don't really want the answer to.
For the second one, if you changed it to how can we increase screening for new moms? Oh, sorry. How can we increase screening for new moms for postpartum depression? Would that become adaptive, or is that still technical?
Kind of a liner. I really like the top one. I like the top one. The top one makes me much more nervous, but I like the top one. That's the one I really want the answer to. The top one is going to require more patience, and the top one may, at some point, include a subgroup of people going out and figuring out, well, is there a way to screen where we could get more people screened and it would be more actionable and it would actually drive toward the top thing? It's not that that bottom question's wrong by itself. It's wrong if it replaces the top one. It's only the wrong question if it replaces the top one. In the context of the top question, that bottom question is okay to go answer. But let's make sure it's in the service of the bigger, more adaptive. Does that make sense? Okay. We're rolling on. So the 3 related questions. How did we get to the 3 related questions? We did a process with a room about this size, full of people who all worked in or with the Kentucky Commission. And essentially, we did an appreciative inquiry approach. How many of you are familiar with appreciative inquiry as a tool? Okay, a few. I think it's so awesome. It worked great in Kentucky, I think. Ivy, did you agree? Yeah, it was. So this is a great tool. It's called Appreciative Inquiry. It comes from David Cooperrider. This is really how simple it is. It focuses on naming a desired future and naming successes that you're having now, and then designing what'll help you get to where you want to go. It's so simple, it's almost embarrassing to say that on camera, but that's what it is. Part of what drives this tool is curiosity and inquiry. It's asking curious questions of each other. In the Discover section, the questions are things like, what's working well for us or for you, partner? What are you most proud of? Where's your passion around this? These are great conversations. And we stop having that conversation and we have the dream conversation. And the dream conversation is, never mind where we are now, where do you want to be? What would make this awesome for you? Go big. What are your hopes and dreams for whatever thing it is we're working on together? So what are your hopes and dreams for the commission in the next 5 years is what we did in Kentucky.
What if you have a number of who are coming together on a question but might have different agendas? How do you?
Perfect. Perfect. Yes. We're going to find out what those are. And we're going to be curious. We're going to actually authentically say, no, really, what do you want to have happen? What would be great for you? Kentucky did that too. They did that too. We have a picture of it. One of the questions that's worked well for us is the question, what do you wish you had? In other words, different than what do you not have? Except it's going to uncover what you don't have. But uncover what you don't have by saying, what do you wish you had? Let's talk about fulfilling our wishes together. What do you wish you had? Here's where you get strategic in the design phase of this. The main question in the design phase is, what do we need to build together structurally in order to get to that dream? Let me give you maybe 2 minutes at your table. What are some structural things that might be parts of design answers? So imagine those Kentucky questions if you want, or imagine the question that you have. If you asked yourself, what do we need to build in order to get to our vision, what would you put in that box? What might be types of things? Yeah, come on back. Come on back. So, some examples of what the types of things you're going to find in your design box. You guys are so excited. This is great. Very excited, very excited. All right. Come on back. Welcome, welcome. Come join us.
There's some chairs over there.
The kinds of things you're going to get in this box, the kinds of things you're going to get in this design box, the kind of things you're going to get in the design box have to do with resources, policies, training, meetings, structure. I mean, it might be job descriptions. It might be changing the measures. It might be running some tests. It might be all kinds of things. Let me show you an example. Amy Mullenix and I got to go to American Samoa last year and do this with a group in Pago Pago, and it was awesome. We did about a 6-hour meeting, and these are the outputs on the wall. That's Ipu there in the middle, talking through one of them, and I'm going to zoom in here on the. This is a priority matrix, which is one of the tools we want you to know about. So they did this. The define and discover and dream. They got really excited about the what do we wish we had. They were working on rheumatic heart disease. Do you all know about rheumatic heart disease? You might know in Hawaii. Kids in American Samoa get strep. Kids in American Samoa have difficulty getting treated for strep, sometimes because they don't know they have it, or they just don't get treated for a variety of, and it tears up their heart valves, and then they have heart disease. It's a really big problem there. We solved it here in the 50s, and so quit paying attention. They're still dealing with it. So here's one of the output priority matrices for a whole set of strategies and activities around screening. Priority matrix, you just divide a piece of paper into 4. You've got easy and hard, moving left to right, so the far left-hand column are things that they think are pretty easy. All the way over to, on the far right, are the things they think are really hard. And then up and down, the things at the top are things we think are really important, and things lower down on the page are maybe not so important. So they started on the quick wins box, and they've got a bunch of stuff in their quick wins box. Really important? Seems like it would be easy to do. Let's do those. I'm going to turn it over to Amy Mullenix at this point. How are you guys feeling so far? You feel like you're getting some traction? Any questions before we go on and talk about perspectives? Love how you're digging into this. On the tables and the table auxiliary people, I hope, are happy with how it's going. Amy.
Good morning, everybody. I'm going to talk about perspective. So, and I'm also going to say we are going to give you a break that's coming right after me. So, no pressure, but there's a break coming. No pressure on me. I'm going to help us think about your question, which is, so everybody brings an agenda to a big strategic question, and what do we do about that? So I think in MCH we're particularly good at understanding that our answer to any given question might not be broad enough. And so we're awesome. We invite the people from the schools, we invite the people from the housing authority. We're good at this, right? So we're going to spend a little time thinking about how particularly to do that when applied to a strategic question. And I'm not going to take a vote about whether or not you think that's 3 or 4. I am going to say, though, that those perspectives matter and should count. And as leaders who are convening people around challenging strategic questions, it is part of our job to think about the perspectives that other folks bring. So if you've ever been on the London Underground, this is the train platform, right? It says mind the gap. So I'm standing here and I want to get on the train and there's a gap. And what I need to do is pay attention so that I don't fall in. Same thing with our perspectives. I have a current state. Let's take a super easy example. Let's say I'm hungry and I have a desired future state, which is that I would like to be full and that it would include chocolate. So the gap between current and future is just something that I need to pay attention to. Now in that example, my perspective on how to fix that challenge would be easy. It would be like, eat something, right? But Janine may be observing me, and her observation might be that, not that I'm hungry, but that I'm mean, or that I'm something else. That might be her perspective. Other people might have other reasons that they're observing my perception of my challenge. So being hungry is clearly a technical and not an adaptive challenge, but sort of the same thing applies, right? We want to think about that gap between where we are, where we want to be, our particular MCH way of viewing the gap or viewing the challenge or viewing the opportunity, even if we've used appreciative inquiry. But viewing that possibility is one perspective, and because it's on our action plan, it may end up being the most important perspective, but there are other viewpoints that we want to consider. So who gets to define the gap is a question we want to ask ourselves. And then if it's really us, if it's on our MCH action plan, the next question is, okay, that's fine, maybe I'm the ultimate decider, if that's a noun, which it might or might not be. What to incorporate everyone else's agenda in coming up with a plan that's going to work for everybody. It's really a question of where we're sitting, right? So sometimes when folks bring us a different agenda and we're like, no, that's not really the problem we're working on. The problem is this. They're coming from a different place. And if we're leading the initiative, it's our job just to remember that this is happening. And that this can, not only it's happening, but that it's good. Because that means we invited the right person to the meeting. They don't have the same answer. They don't have the same list of strategies. So that's where we want to get to. I'm not sure that we have time for table talking, so I'm going to just ask a few of you to shout out, and I'll run with the microphone. What do we do well in gathering diverse perspectives? And are there things maybe that we wish that we were gathering that we're not? Somebody have an idea? I think we do a lot of things well here. What do we do?
I think in MCH we do a really good job of bringing together diverse stakeholders from many different sort of segments and different fields. I think often we probably bring together the same stakeholders over and over again, so that's something we can maybe do better.
Other comments on this? Any of these questions? Okay. I'm going to talk very briefly about 3 different levels of gathering perspectives. These are things that you know, but I sort of wanted to lay them out in a logical order because my brain works that way. So I'm going to start at the individual level. This is the level that we can control, especially when we have a big strategic question in front of us. One way that we can wrestle with it on our own is just getting feedback from other people. If we have a staff meeting and we're thinking about it and I say, so here's what I think our strategic question is, or here's the next big thing that we're going to wrestle with, and everybody around my table says, yes, that's it, then I think one of 2 things is happening. Either they are afraid of me, or or I haven't asked enough people. What you want to get to is people who are going to push back on your question, like, well, maybe, but it could also be this other thing. So a way to approach this, a tool to do this, make sure that there is at least some resistance in these strategic conversations to what you're putting on the table. You want it to cook a little bit before everybody feels good about settling on where you are. Don't rush too fast. I mean, we only had 3 hours, so we had to rush you through this morning a little bit on the strategic question identification. Back home, you're going to want to sit on that and reach out and get some other folks to give you some advice on that. Within a team, has anybody done strengths finders assessment? So that identifies for you who strategic thinkers on your team are. It's a self-assessment sort of personality or sort of work style assessment that you can do and figure out the strengths on your team. If you have used that tool, some people return on their assessment that they're good at strategic thinking, planning, or maybe it's called strategic leadership. Think about who those people are when you're having these conversations. Make sure they're in the room, and then be prepared for how they work. Because how they work is different than how most people work, which is like, let's get to the answer. I heard some of that here when we were asking you to think about your strategic questions. Some people are like, let's figure out how to fix it. Have you tried this program? This. So that is a good skill to have, but it is not the strategic skill that you want when you're having this conversation. You want the people who slow you down and say, wait a minute, what is the really big purpose of our work here? And if you're a person in a meeting and somebody asks that question and you go, oh, do we really have to go over this again? So just a moment of self-reflection, you should say, oh, that's a strategic thinker, and I need to figure out how to use them more effectively in meetings. They're going to ask the hard probing questions, and they're going to slow us down a little bit. And it feels sometimes like resistance, and that's good. So that's a skill for you, to being able to identify who slows you down and why. It may just be that they're being that way, but oftentimes it's because those of us with that skill like to slow processes down. That's me. Because we want to make sure that we're not spending 4 months answering the wrong question and getting something that's not getting us to, farther down the road. Outside your team, this is where I'm going to spend a little bit of time and have you do some work. So we've talked about ourselves, our team. Here's the question which we simplified. We're really good at this. One thing to consider if we're inviting the same people, even if it is the same people or if it's new people, think carefully when you are inviting those people to your table about what they need and what they want. They may be coming just out of the goodness of their heart, but if we have a conversation before the meeting, what do you want to get out of this meeting? What's the win look like for you? That will open up a whole nother world of possibilities for you that might end up with you being on their committee and you being able to advance your objective at their table. I think that's, MCH is great at inviting to our table and less great about showing up at their table, because we can get our work done at their table just as easily as we can get our work done with them at our table, right? So do your homework, think about what they want and what you can help provide for them. Think about the things that you want to get in common. This middle section, collectively seek new perspectives. We're going to do a couple of exercises on that, so I'm not going to talk about that. Make sure if you're going to their table that you can articulate what the MCH value is in their strategic question. We have value, I think, in every strategic question that exists in public health, in all of the conversations about social determinants, and we have to be able to articulate it. So that's part of this sort of back and forth and looking for opportunities to support their work in their context. So here's something we did in Kentucky. We just got on the Kentucky roll, so here we are. This is a tool to use. I didn't make a handout for it because it's like super simple, and when I explain it, it's super simple, but I don't observe that we in MCH use it a lot. It's a way to gather new perspectives about your challenge or your strategic question in the course of a regular meeting. So this activity takes probably less than an hour, I would say 45 minutes. So let's imagine, and I'm kind of imagining Kentucky, so we have 15 MCH people, you're pulling together about a bullying initiative, let's say. So you have your 15 usual suspects, but you're going to be smart and you're going to bring somebody from the school system and maybe a school resource officer and maybe someone from an adolescent pregnancy prevention group because they know about adolescents. So you say you have three outside perspectives you want to bring in this meeting, and you have 15 of you. You're going to say, we're going to really dive deep. I'm not going to ask the 3 new people to just respond in the middle of a group that they're new to. They don't know my language. They don't know my acronyms. I'm going to give them safe space. I'm going to dive deep, and I'm not going to let them leave this meeting without understanding their perspective. So you just divide up. This little group of 5 people here is going to spend literally 5 minutes, and you're going to write an interview guide. And it's going to say, so I know I'm interviewing this school resource officer. I want to know, what does bullying look like to them? I want to know. I mean, you can think of these questions off the top of your head. So your group comes up with those questions. Your group is coming up with questions for an adolescent pregnancy prevention person relevant to bullying. And your group is doing the third group. Then you sit with that stakeholder at your table, having asked their permission. For 10 or 15 minutes, you ask your questions. You listen to the answer. You don't expect them to understand your whole frame of the problem. You just want their expert opinion, right? And then you synthesize back and share the learning. Does that make sense? This is what it looks like in Kentucky. So the gentleman with his back to us is a physician who works with a lot of kids with special health care needs. These folks spent maybe 5 minutes. The 4 facing us are Commission for Children with Special Health Care Needs. They wrote 5 questions in 5 minutes, and then they spent 20 minutes, and he got really deep and gave them a lot of perspective. I think the woman with gray, short hair facing us also in the back, is she from Medicaid?
No, the one behind her.
So the same thing is going on at that back table, and the same thing is going on at this table. I mean, the whole exercise took maybe 30 minutes, and then we synthesized out, and we learned a lot more. So the goal here is learning than we learned if we would have just had the regular meeting and said, what do you think, Medicaid? That's really putting people on the spot. I don't like to be put on the spot like that, but this, I can really tell you what I really think, because there's only 4 of you and 1 of me, and then I'm not responsible for reporting that out even. Somebody else reports that out. Leslie, we're on camera, so you have to say your question into the microphone.
I just want to know if it can work with what we would call community experts or consumers that we're bringing to the table, or if you would change it up a little bit so that it's not one, quote, consumer against all these professionals and paraprofessionals. So how do we do that?
Anybody have a thought on that? I would say I think it could work if you framed it well. Has anybody tried that? Doing an interview with a consumer or a parent representative or a... So as a parent or a community representative, I'm going to feel a lot more comfortable having this happen like that rather than being called on in a meeting. The other thing I might suggest is the next thing I'm going to talk about very briefly, which is a partner interview. So this is just a variation on the same theme. Perspectives about your challenge. You're going to reach out to that person. This can usually happen in a phone call. It doesn't necessarily need to be one-on-one. But it needs to be somebody who's outside your challenge. So the Medicaid person, or even somebody who works in a different silo of public health, so that you don't have to describe the whole public health thing. But it can be somebody from the next building who also is in sort of the broad domain of human services that you know. This is somebody you're going to reach out to and just have a private conversation. The trick here is you're going to say to them, look, we're wrestling with this kind of big string, and I just want to bounce some ideas off of you. You are not going to describe it, for them in depth, like where you're stuck, why so-and-so won't cooperate, why this hasn't worked for 10 years. You're going to give them the broad overview without all of your baggage, and you're going to focus on the strategic question. So you will have thought in advance about how you could frame this as a strategic question, and then you're going to throw it out for them. And then you ask them, what do you think? Do you have ideas? So there's this whole emerging, have you heard of design thinking or consumer-centered outcomes? They always advise us that we should invite like a construction worker, a ballet dancer, people from really far outside our field are going to have really different ideas. So I'm not suggesting necessarily that you stop a construction worker on the street. I am saying the further outside that we push our perspectives, the more we may uncover things, which may or may not change our selection of strategies, but they will at least give us this sort of, get us out of our group think and our silos. So you just ask these questions. Do we have time to practice? So we're going to practice. I would like you to find a partner, somebody next to you who has not yet heard of your strategic challenge. I mean, you may have shared it with the table, but someone not from your agency. Describe in 1 minute. Force yourself to describe your question or your challenge in 1 minute. And then ask them these questions. And then switch. So in all, I think I'm going to give you about 6, try 3 minutes for the first pair, and then switch and try 3 minutes. That's pretty quick, but let's try it.
I can do it a little longer. It's only 10. We go to 12, right? So as long as I'm on by 11, we should.
Come back, let's come back, let's come back. I have to do this? I know. Hi, everybody. Welcome back. So that was a very lively conversation. So I have some questions about that. So I'm particularly interested in this group in terms of number 1, and I'm not going to have you do it at the table. Let's just talk out loud. What did you notice about your description of your problem? How did it feel to describe your strategic challenge in 1 minute? Okay, you said that out loud, so can you say more about that?
It was very difficult to narrow it down because as I was stating it, I was realizing but it helped me narrow it further, but it was hard to say it in 1 minute.
Anybody else have a similar experience that it was difficult to get it down, right? So what did you learn from each other? Did anybody get any new insights? I see head nodding. Does somebody want to share a new insight? Or just the experience, how it felt? Does it feel like something you could use in real life? Yeah. Yes. Sorry, we're being recorded for future time travelers, so you have to say into the mic.
I thought it was, yes, it's amazing. So we come from completely different areas. She comes from the area of children with special health care needs, and I come from my public health background. And I got so many I was just like, oh my gosh, that is the most brilliant idea. So yes, definitely something extremely valuable. And I love the idea of bringing in the ballet teacher and bringing in the firefighter, just the really random out there possibilities, because those are going to be some of your little nuggets that you're not going to get anywhere else.
Yeah, or even if you have a walking partner at work who's from a different division or a different area, or somebody you walk with who's not from your work in the morning before work. I mean, this is one practice that leaders use a lot. They have friends in other disciplines, and when they get together, they don't just talk about golf. I guess they do this intentionally. They bounce ideas back and forth off of each other. So hopefully that was helpful and something you can take home. The last thing I'm going to say before the break, then the break is here, is another tool to explore. So you don't have a handout because we don't have time. There are whole entire 3-day courses taught on design thinking. It's also called human-centered design. It's emerging now in sort of the human services world. It has been prevalent for many years in the business world. Folks use this practice to sell us things, and it is now entering our world. So I just wanted you to know about it. If it's something that sounds interesting, you can explore it later. It is the way that we currently do our work. If you think about how we do our work, empathize is a form of needs assessment. in design thinking, it's not completed as a focus group or a needs assessment. It's done by going to observe someone in their natural environment and just hang out and watch how a clinic system works, for example, or neighborhood looks like. So there are lots of examples of how this happens, but I don't want to propose it to you as an entirely new thing. It is the way we do our work. So empathize is this understanding what the end user of our process needs and wants. Once we do a lot of observation, and the blue blob is big because we want to do a lot of observation, then we sort of define where it is we want to go, what we want to do. Ideate is brainstorming. We do this all the time. You're doing this already today. This is what we're good at, developing strategies. Thing that we almost never do, which is try our new thing on one person, or not even make the new thing, draw a picture of a new thing. This is how they recommend that you do it. Draw a picture of your new thing, make a little storyboard, and then show it to a customer and have them say, well, yeah, except for step 3 sounds really silly. What are you talking about? So it's almost like a PDSA, what would happen before you did. So it's the plan, do, study. So it's the study of the PDSA, but without going whole hog and changing a form and whatever it is that you're attempting to prototype, that you just test out on 1 or 2 people, and then you test. There are many examples of how this is used in life. The one I think about for myself is, I was super excited 5 or 6 years ago. I got a new car and it had keyless entry, which is awesome. I don't have to take my keys out of my purse. I can just open the door. But I do have to put my hand on the door for it to unlock. Along came somebody who does design thinking, and they noticed that I was going to my car and my hands were full with all my kids' stuff, and I get there and I'm like, I can't open it. So these are the people literally who designed the foot underneath, and it opens for you. So it's still keyless, but they watched people in parking lots and they're like, holy cow, all those people have a lot of groceries. They can't even put their hand on the door. So this is just a little bit different way that we wanted to just briefly introduce you. If you're interested, there's a lot you can read online, even about how people are doing design thinking in MCH and public health work. It's a separate workshop, but I did want to expose that idea to you anyway. Now what we're going to do is take a break. What time is it?